Most people have never heard of H. pylori, yet it may be living in their stomach right now. If you've been dealing with bloating that won't go away, a burning feeling in your upper stomach, constant burping, nausea, or unexplained fatigue, you're not crazy, you're not overreacting, and you're definitely not alone. H. pylori, short for Helicobacter pylori, is a type of bacteria that can live in the lining of your stomach. It's incredibly common. In fact, millions of Americans carry it, and many don't even realize it. So how does it happen? H. pylori usually spreads through contaminated food, water, or close contact. It often enters the body years before symptoms begin. Once inside, it burrows into the protective lining of the stomach. Over time, it weakens that protective barrier. This allows stomach acid to irritate the tissue underneath. And that's when problems begin. For some people, it leads to chronic gastritis. For others, painful ulcers form in the stomach or small intestine. In more serious cases, long-term untreated infection can increase the risk of stomach complications later in life. But here's what makes H. pylori so frustrating. The symptoms are often vague. You might feel full quickly even after eating small meals. You might wake up with nausea. You may notice frequent indigestion, heartburn, or a dull ache in your upper abdomen. Some people experience unexplained weight changes. Others just feel constantly off. Over time, this infection can quietly drain your energy. When your stomach lining is inflamed, your body struggles to absorb nutrients properly. That can affect iron levels, vitamin B12, and overall digestive balance. The result? Fatigue, brain fog, mood swings, and low resilience to stress. It doesn't just affect your stomach. It affects your daily life. Imagine trying to focus at work while dealing with constant bloating. Imagine skipping social dinners because eating makes you uncomfortable. Imagine feeling anxious every time your stomach starts to burn. It chips away at your confidence. Digestive discomfort can also disrupt sleep. Lying down sometimes makes symptoms worse. Poor sleep then increases stress. And stress can increase stomach acid. That creates a frustrating cycle. Many people try over-the-counter antacids for relief. Sometimes they help temporarily. But if H. pylori is the underlying cause, masking the acid alone won't solve the root problem. The good news: H. pylori is testable and treatable. Doctors can detect it through breath tests, stool tests, blood tests, or sometimes during an endoscopy. If confirmed, it's typically treated with a combination of antibiotics and acid-reducing medication for a specific period of time. But medication is only part of the healing journey. Your daily habits matter more than you think. If you're dealing with H. pylori or suspect you might be, the first step is awareness. The second step is supporting your body while it heals. Let's talk about what that looks like. Start with your diet. Your stomach lining needs calm, soothing support. Focus on simple, whole foods. Cooked vegetables, lean proteins, oatmeal, bananas, rice, and broth-based soups are often easier on the stomach. Reduce spicy, fried, heavily processed, and highly acidic foods for a while. Limit coffee and alcohol, especially during treatment, since they can irritate the stomach lining. Hydration is key. Sip water throughout the day instead of drinking large amounts at once. Herbal teas like chamomile or ginger can feel soothing for many people. Next, think about gut balance. Probiotic-rich foods like yogurt with live cultures or kefir may help restore healthy bacteria, especially if you're taking antibiotics. Some people also benefit from probiotic supplements, but it's best to discuss that with a healthcare professional. Now let's talk about stress. This is huge. Your stomach and brain are deeply connected. Chronic stress increases stomach acid and inflammation. If your life feels overwhelming, your digestive system feels it too. Simple stress management habits can make a powerful difference. Try slow breathing for 5 minutes in the morning. Inhale for 4 seconds. Exhale for 6. This signals your nervous system to relax. Take short walks after meals. Gentle movement supports digestion and lowers stress hormones. Limit late-night screen time. Prioritize 7 to 8 hours of quality sleep whenever possible. Your body repairs itself during rest. And please remember this: healing takes time. Many people expect instant results after starting treatment. But the stomach lining needs weeks to fully calm down. Be patient with your body. Consistency beats perfection. Avoid skipping medications. Finish the full course if prescribed. Follow up with your doctor to confirm the infection is gone. Reinfection is possible but less common when hygiene and food safety are strong. Wash hands thoroughly. Be mindful of food preparation. Drink clean water. These simple habits reduce risk moving forward. If you've been silently struggling with digestive discomfort, don't ignore it. Persistent symptoms deserve attention. Early treatment prevents bigger issues later. And here's something important to understand. Having H. pylori is not a personal failure. It doesn't mean you did something wrong. It's a common infection. What matters is how you respond now. Your body is incredibly resilient. With proper treatment, supportive nutrition, stress management, and consistent habits, most people recover fully and feel dramatically better. Imagine waking up without that burning feeling. Imagine enjoying meals again without fear. Imagine having your energy back. That's possible. Start small. Book a doctor's appointment if symptoms are ongoing. Make one dietary improvement today. Drink more water. Take a walk after dinner. Practice deep breathing tonight before bed. Small daily actions compound into real healing. Your digestive health is the foundation of your overall wellness. When your stomach is calm, your energy improves. Your mood stabilizes. Your focus sharpens. Your sleep deepens. And when those pieces fall into place, life feels lighter. If this message resonates with you, take it as a sign to listen to your body. You deserve to feel good in your own skin. H. pylori may be common, but living with discomfort doesn't have to be. Choose awareness. Choose consistency. Choose healing. Because your health is not just about surviving symptoms. It's about reclaiming your strength, your comfort, and your peace of mind. One steady step at a time.